Keto diet pros and cons. If you want to boost your health and fitness goals this year, you might think about trying the ketogenic diet. You've probably heard this phrase before, but it's a huge diet buzzword for those who aren't sure what it means. Here is a primer on the keto diet. A nutritional plan that pushes the body into ketosis, a condition where the body uses fat instead of carbohydrates as the primary fuel source. On this diet, the majority of the calories you consume are from fat and protein but low in carbohydrates. Ketosis occurs when you eat a lower calorie diet with higher good fats and very restricted carbohydrates. Before you dive in, it is important to know the potential benefits and risks of keto. Research supports the implementation of a ketogenic diet in at least 3 circumstances: to assist in the treatment of epilepsy, to treat type 2 diabetes, and to support weight loss. Although the latter 2 purposes require further studies, here's what to do with a keto diet. With regard to diabetes, the most promising research results show that ketogenic diets can improve glycemic control. It can lead to a reduction in A1C, a key test for diabetes. It measures the average blood sugar control a person has over 2 to 3 months that can help reduce the drug use. For people with diabetes, one of the biggest concerns is that if you eat a lot of fat on keto, some of it could be saturated, which is unhealthy if consumed excessively. A particular concern for people with type 2 diabetes and an increased risk of cardiovascular disease is that saturated fat can increase LDL cholesterol levels in the diet and the chance of heart disease. A high total fat intake can be a challenge for keto beginners. If you have type 2 diabetes, talk to your doctor before trying a ketogenic diet. Your doctor may recommend another weight loss diet, or you may be on a low-calorie diet to treat diabetes. Patients with epilepsy should consult their doctor before using keto as part of their treatment plan. According to a systematic review of randomized controlled trials published in June 2020 in Advances in Nutrition, the keto diet could help improve short- and long-term cognition in people with Alzheimer's disease who already have mild cognitive impairment. Researchers warn, however, that more research is needed to confirm these findings and demonstrate a cause and effect relationship between diet and dementia prevention. With regard to weight loss, if you are interested in trying the ketogenic diet, you may have heard that it can have a big impact. That may be true for some. Ketogenic diets can cause you to lose weight, especially in the first week. It is motivating to see numbers fall on the scale. But remember that most of these numbers are due to water loss. Your body uses its glycogen stores for storage in the form of carbohydrates. With depleted glycogen, the water weight decreases. The keto diet can be an effective option over time. Taking it for a few weeks to a year can boost fat loss in obese people, a study suggests. Another meta-analysis found that one of the most likely reasons for weight loss is that diet suppresses hunger. One disadvantage of the ketogenic weight loss diet is that it can be difficult to maintain. Studies have shown that the weight loss caused by a low-carbohydrate diet for more than 12 months tends to correspond to a normal, healthy diet. While you can eat more filling fats such as peanut butter or regular butter, you are more limited in what is allowed on the diet, which can make everyday situations such as dinner with family or going out more difficult. While some people find it difficult to maintain themselves, it is easier to rely on the keto diet as a short-term diet than on a long-term lifestyle. Another potential downside of the keto diet is keto flu. According to Harvard Health Publishing, headaches, muscle spasms, fatigue, nausea, constipation, and other flu-like symptoms may occur in the first few days after starting your keto diet. These symptoms usually resolve in a few days, and according to an article published by StatPearls in June 2020, you can counteract them by consuming plenty of fluids and electrolytes. Do not make this dive without medical supervision. You can work with a local dietitian or nutritionist to limit potential nutrient deficiencies and discuss vitamin supplements if you don't eat whole grains, dairy products, or fruits, or eat too many vegetables. A diet that eliminates whole food groups can be a red flag. Start by asking yourself what is realistic for you and what would be right for your doctor. If you decide to try the keto diet, you will want to stick to the parameters of the plan. What is different from a traditional low-carb diet is how few carbohydrates are allowed on the ketogenic diet. This means that you can only eat meat, fats, and oils, and a limited amount of starchy vegetables. Between 60 and 80% of calories come from fat. Carbohydrates and total fiber are equal to net carbohydrates. This means that if you eat a small portion of blueberries, your body will burn carbohydrates as fuel instead of fat. The remaining calories on the keto diet come from protein, which is 1 gram of body weight. Example, a 140-pound woman needs a total of 64 grams of protein. The carbohydrates in the body are different for everyone, but most people stick to keto with 20 to 50 grams net carbohydrates per day. One thing not to forget is that it is easy to get rid of keto. For more help and guidance on how to work the keto diet to better your health, lower your weight, and feel better, please see our link in the description below. Thanks for watching and see you next time.